The coronavirus pandemic knocked the doors of the delicate health system, forcing President Uhuru Kenyatta declare closure of schools.
We have suspended learning in all our education institutions with immediate effect.
It's almost a month now, and for women and girls, essential concerns and grievances seem to be ignored. Key among them, the issue of distribution of pads or sanitary towels to girls from needy backgrounds, like Kibra, as Patricia explains.
Nimemaliza shule sahi. Back then kwa shule tulikuwa tunapatiwa pads, but ilikuwa inakuja moja per month. Na kulingana na shule ilikuwa unaenda ukianza ndio unaenda kupata mwalimu ndio anakupatia hiyo pad.
So sisi tulikuwa tunapewa 2 kwa mwezi mmoja.
For girls from families that live below $1 a day, menstruation during COVID-19 is a complicated issue. This is because it strips them of their ego, dignity and privacy.
Kwa huu muda wote tukiangalia katika mabanda kupata hata hela kwa wao wanafunzi na wazazi wao imekuwa vigumu sana. Si kazi zote zilishafungwa, si safari zote zimeshafungwa.
This comes in with a lot of anxiety, a lot of stress, and even finding it difficult because if they will get any small job to do, then they are made to wonder, are they going to put food on the table? Are they going to pay their rent? Or are they going to buy the pads?
Sasa hatupewi.
Kwa nini?
Kwa sababu ya corona.
Na mnaishi aje hapa? Now that hampewi.
Sasa sisi hapa tu wakoro ni mahasla hivi, alafu so unajua tu ile yenye watapata ndio sisi tutapewa hapa nyumbani.
Kwamboka Onsere is a student and going through the same in Kibra. The sanitary towels was first launched in 2011 by the Ministry of Education with a view to procure and distribute sanitary towels to girls from disadvantaged backgrounds. And according to the Ministry of Public Service and Gender, it is estimated that the government has pumped 1.9 billion shillings into the program benefiting 11.2 million girls, a dream that is yet to be accomplished by the government during COVID-19. In the 2017-2018 financial year, the Department for Gender Affairs, that is charged with the responsibility of procuring and distributing sanitary towels for 3.7 million girls in public schools, special primary schools and secondary schools in the country, was allocated a budget of 400 million shillings. I decided to find out if indeed the girls still receive free sanitary towels that they were getting during their school days.
Kumaliza shule supply ilisha. Unajua sasa uko shule ndio uko capable kupata hiyo pad. Ukitoka shule au uko in contact with walimu, sasa inakatika hivyo.
Changamoto kwa sisi wasichana wa Kibera ni mingi sana. Unaweza pata mwingine amejichafua ukipita kwa barabara, wengine wanamchekelea. Sasa unaona hiyo pia inaleta aibu. Ukichekwa pia unaona pia haufai.
This journey took me to Kibra, the biggest slum in Nairobi. In a society that now depends on food, rent, water, sanitizers, masks and other necessities as donation, sanitary towels have been forgotten.
Ukope, ukishakopa alafu utalipa siku nyingine.
Na kama una pesa kabisa?
Kama una pesa kabisa, si utakaa hivyo tu. Utaweka kitamba.
It's a struggle kwa sababu in slum wase ni tofauti. Kuko na mwenye anaweza afford your pad, kuko mwenye hawezi afford. Unaona? Anaweza kosa completely hata akatumia tissues ama matambara ambapo ni bad kwa health yetu. Unaona?
When the girls and the ladies don't have enough provision of the pads, then it becomes very difficult for them because they will have to look for other alternatives, maybe using the tissue paper, using old rags, using old pieces of clothes, and maybe even at times if it is a piece of cloth, they need water to clean these clothes. We know this is not very hygienic. It might also give them some infection.
Formative research shows that girls and women in general face monthly challenges, with 65% in Kenya unable to afford sanitary pads. Only 50% of girls openly discuss menses at home, and just 32% of rural schools have a private for girls to change their menstrual products, while only 12% of girls in Kenya would be comfortable receiving information from their mothers. With 60% of population living in informal settlement in Kenya, experts argue that the invasion of COVID-19 has brought about anxiety, stress, and uncertainty.
Now, these are some of the rags that are used by young girls in these slums to salvage themselves during menstruation. Remember, during the school days, they used to depend on sanitary towels or sanitary pads that were being given free of charge to them. Right now, the schools are closed due to coronavirus. They don't know where they will get them to salvage themselves this time.
Ndapata chali anidanganye, sina hiyo pad. Chali anidanganye, atanipatia pad, niende ni have nice sex. Unaona, sasa hiyo inanilide. Naweza pata magonjwa during that sexual intercourse, napata mimba, unaona. Ndio maana tuko na mademu wenye wajiezi huku, wengi wako na watoi. Kwa nini haiwezi jiprovidea hizo staff?
Changamoto ambao tumeanza kuona hapa, wasichana wetu katika huu mtaa ama kibanda cha Kibla, tumeweza kuona wameshakuwa wamegeuka, tena si wanafunzi kwa sababu ya ile shida ambao wanayo. Wanaweza kutoka baadhi ya sehemu hii kwenda nyingine. Wengine wameshaolewa kwa sababu matumizi yamekuwa haba.
Lilian Mutua is a county health coordinator and fears that although sanitation has become the main agenda at this time of COVID-19, the approach towards dealing with the challenges of menses remains a significant barrier.
Currently, we have had a household survey where our community health services is identifying different households and enumerating them into validated data, and we are able to map people per age, per sex, and even where their household is. So this is very good data that can be used by the government and both also the partners to come out with verified data that can go into looking at provision of this sanitary ware at household level.
Sai consider watu yao wako shule, hakuna government yoyote yenye hizo nini program zenye zimefikia door to door. Sijaisikia, maybe kama konazo ni chache yenye sijasikia of any. Hapa sasa mademu ni kusafa kweli.
Studies show that parents believe it is their responsibility to speak to their children, yet majority of them find it difficult to speak to their children about sexual matters.
We also need them to upkeep with their hygiene standards, and we are asking the well-wishers and even the government to come in and work with the ladies and the girls so that as they provide other things like the incentives that are being given at household level, the food stuff that is being given in the household level, the medical services that are being provided at our public health facilities, let us also look into providing the girls and the ladies with the sanitary pads.
Atukatai wamekuwa wakiprovide hizi pads kwa mashule, but sasa pia wafuatilie, wanaweza link up na walimu wafuatilia wanafunzi wao mademu kwa kila household wakiwapatia.
Tunaweza tukauliza swali, je, kuna mikakati yoyote mnaweza kuweka ili tuweze kuwasaidia wasichana wetu?
Uhuru tu afanye jambo, afanye tu kitu.
Though majority of reusable sanitary pads are distributed for free, with COVID-19 situation in Kenya, the government has instructed its citizens to use masks, remain at home, and observe social distance to curb COVID-19. Yet women and girls deserve dignity during COVID-19 pandemic.
And we'd like to ask the girls and the ladies, if you are in very dire situation where you really need these pads, kindly give that information instead of having some sexual advances for you to get the pads, and the pads will be provided.
For Ebro TV, I'm Ode Francis.